Welcome to this special interview on the personal side of medicine, offering a unique perspective on the values and principles that have guided the person who wears the white coat. I'm here with a distinguished doctor who has dedicated his life to healing. Thank you, Dr. Yafi, for joining us and sharing your personal side.
Thank you for having me. I'm very excited to be here.
Excited to have you. So, what inspired you to go into medicine and then later urology?
Ever since I was a kid, the only thing I ever wanted to do was be a doctor. I never even considered anything else. I've always liked the idea of being able to help people. And then I decided I wanted to be a surgeon because I love the idea of being able to intervene towards someone's problem and fix it. And that led me to urology when I did our rotation in urology, and I really loved the variety of urology, as well as all the conditions that are treated. But I also love the humans who did urology. I found that I connected well with them, and this led me to a path down the urology route. And then I subspecialized in men's health and sexual medicine, where it allowed me to even further this by being able to focus on people's most intimate problems that are sometimes difficult to share. And I like to think that I'm able to improve their lives.
Yeah. So, what hobbies or interests do you pursue that influence the work you do?
So I try to stay in shape. I try to exercise. I try to, read, keep my mind sharp. But I have two little girls under four, so they represent the biggest chunk of time. So between my beautiful wife and my girls, that tends to be what I spend the most time doing outside of work, and allows me to stay grounded, and happy, and remember why I do everything that I do.
What personal experiences have you gained through your work that has influenced your worldview or your personal value?
Well, I think when you're a urologist, but more particularly a men's health specialist, and you get to deal with people's most intimate problems, things that they wouldn't share with anybody else, either outside of their marriage or their relationship or the bedroom, it lets you know that, at the end of the day, we're all the same. We all share the same problems. We are all very similar, and it shows you that whether you are from a certain, ethnic, racial, religious, financial background, we're all at the end of the day the same kind of people. And it allows me to, I think my work has allowed me to be more worldly, but also I've had the opportunity through my work to travel quite a bit, to teach across the world, and through courses either virtual or in person. It has allowed me also to connect with more people from all over this globe, and it's just a wonderful experience that just, I think, has allowed me to become a better, more well-rounded person.
What is most inspiring and motivating about the work you do?
I think the by far what inspires me and motivates me the most is seeing patients' outcomes. So I see patients again who are in situations that are cause them a lot of distress and a lot of relationship issues, a lot of psychological issues, and through sometimes minimal or sometimes more invasive interventions, I'm able to restore their quality of life, restore their marriages, restore their relationships, and it is very rewarding. I also have the opportunity to run a research team, and I get to work with young undergraduate or medical students, as well as residents and fellows, and to be able to help them build a career path and mold their brains and give them opportunity. That also is very rewarding to me.
What do you believe are the most important technical and personal qualities for a successful urologist to possess?
I think for a urologist or a doctor or a surgeon, the most important thing is caring. If you care, you've already, I think, done half of the job. But the rest of it is you have to work on yourself. You can't stagnate. You have to keep on improving. You have to know what's new. You have to know what are the new developments, what has changed, what are new indications, what are new contraindications. So as long as you don't stagnate and you don't get lazy and you keep on having that thirst for knowledge and that passion to know what's new and what's upcoming, you're always going to be offering what's best for your patients.
How do you cultivate some of the most important skills like effective communication and building of trust between your patients and their families?
I think again, particularly because I am a men's health specialist, it's really important for me that I'm not only treating the patient alone. So again, I have patients who are single, so it's really important that I focus on them. But a lot of my patients are either married, or in relationships. So it's very important that I'm not just treating the patient, I'm treating them and the couple. So I'm basically treating the partner as well, because the conditions that bring them, sometimes are conditions that bother just them, sometimes conditions that bother them and their partner, the couple as a whole. But I also treat males and couples with fertility issues. So these are people who tend to be very distressed about fertility planning, being able to build the family they've dreamt about. So again, I can't just focus on the patient in front of me, but I have to focus on the whole family. And so the most important aspect of that is, again, to care, to show empathy, and to be there to hold their hand through sometimes difficult processes.
So you talked about hesitations. How do you address patients' hesitations or concerns about seeking your care, especially in men's health?
Yeah, so that can be tricky. Sometimes patients are embarrassed. They don't want to come into the office. Takes them years and years to come in because these are personal problems that are delicate and embarrassing. So the important thing is to make them feel that they're in a comfortable environment. We've built this beautiful men's health facility that is very warm and allows patients not to feel like they're going into, the run-of-the-mill clinic where they're just another, number. I think we treat them as individuals who are here with individual problems, and we show them the affection and the attention that they need. But the most important thing in all of this is that I focus on telling them that they're not alone, that there are a lot of people who share their same problems, and that they're in the right place, and that hopefully through either, again, minor or more major interventions, we can work together on improving the quality of life and fixing whatever problems they are harboring, and they've been fighting really hard not to share, or not to discuss.
Well, so the field of urology is constantly changing. How are you involved with and preparing for these changes?
So again, you have to keep your ears open. You have to be interested, but you have to be involved. So you can't just sit and passively learn. Learning is active. So I'm involved in many societies, whether just as a member or as a leader in those societies, which allows me to be at the forefront of what's coming, at the forefront of what's getting presented. So we attend meetings, we attend conferences, we teach. But beyond that, I also have a very robust research team with research students, research fellows, clinical fellows, and through that, we're always seeking to find new developments, new interventions, new techniques to improve patients' quality of life and care. And as long as as long as you're not you're not stagnant, or you're not lazy, you're gonna keep on learning, and you're gonna improve patients' quality of life.
Well, your dedication to your patients and profession is truly inspiring, and we wish you all the best on your continued impact on the world.
Well, thank you for having me. It's been a pleasure, and I hope to see all the patients who have any kind of mental health issues here in the clinic with us in Newport or in Orange. Thank you.
Let us take a moment to reflect on the values and principles that shape our own lives and the impact we can have on the world around us. Until next time, this has been a special interview on the personal side of medicine.